keep you living healthier and that your health is optimized. So, in the month of March, according to the World Health Calendar, so many amazing things are happening. World Speech Day definitely happened in March, and it's been a very interesting one, as well as World Hearing Day. All these are quite important because they all refer to development and milestones, so it is quite important. I bet you didn't know this fact. Oral Health on the 20th of March is a day commemorated by the medics to ensure that your oral health is given the priority. Your oral health affects every part of your body. So if you haven't gone to the dentist, I think you should make that call. That's it for now. I'll give you a little bit more details after we get our health news.
Speaking at the handover ceremony of the solar facilities supported by Gavi, the Vaccine Alliance, and UNICEF at the Pool Primary Health Care Center in Abuja, the minister said the intervention in 371 primary health care centers across 17 states and the Federal Capital Territory will ensure reliable electricity supply for vaccine storage and other essential services. He explained that stable power will strengthen vaccine cold chains, improve working conditions for health workers, and support digital connectivity for health data reporting.
Beyond that, it also impacts the community. The solar is not only going to light up the facility, even the neighboring facilities, the neighboring communities will see the benefit of this enhanced light. So it's building the primary healthcare center is really at the center of the community, and we're reaching that by converging effort.
As we celebrate this achievement and we look ahead, continued collaboration is vital to maintain. Also for this facility, we have to look at ownership, we have to look at maintenance, we have to look at continuous functionality.
The facility has power and light, and this means that at the minimum, they won't be able to turn back any patients at night because of the lack of light and visibility. So it's a good example to show how much just 8 kilowatts can change in a health facility.
The executive director of the National Primary Healthcare Development Agency, Muyi Aina, said the project specifically targets communities with high numbers of zero-dose children who have missed routine immunization. He noted that the solar system will help upgrade the affected facilities to level 2 primary healthcare centers with essential infrastructure, including power, water, sanitation, medical equipment, and other commodities required for effective service delivery.
In all, we are revitalizing actively over 4,000 PHCs now. Almost 2,600 of those are completed. These sort of solar power systems have been put in almost all of the revitalized, but beyond the ones that are revitalized, there's another 400 or so that have just been given solar power because that's all they need to get to level 2. And all of this, again, for everyone here, can be tracked on the PHC functionality dashboard.
Without lights, we cannot do anything. Without lights, we cannot even be here today. So this is not only for vaccines and immunization, it is indeed a game changer for the health systems.
This energy that has been provided is sufficient to cater for the cold chain systems, is sufficient to cater for all the service delivery points, whether it is ANC, it is OPD, it is sufficient to cater for it. It's also sufficient to cater for night service of the facilities. So whatever the facility needs to run on, these 8 kilowatts inverter systems that have been provided is sufficient to cater for that.
Health authorities say the solarization project is expected to strengthen vaccine storage, improve service delivery, and enhance healthcare access for millions of Nigerians in underserved communities.
eHealth Africa, a leading health organization globally and in the African space, put up a convergence for stakeholders to meet on the antibacterial resistance stakeholders meeting and community access to effective antibiotics initiative. Come watch.
We know antibiotic resistance continues to be a challenge to public health, not only in Nigeria, but globally. I mean, we heard today that over 40% of burden it's being of people are being impacted on because of AMR, which is antimicrobial resistance. And so last year, JPIGO and eHealth Africa bidded for a grant that was funded by Trinity Challenge UK, and that grant was applied they had over 200 applications from over 50 countries, and Nigeria won. And my team and I led that application process, and we won the grant funded by Trinity Challenge to generate data to help with stock control for antibiotics and also substandard and falsified antibiotics.
This preferred solutions for an integrated data-driven technology designed to control stock in real time and detect substandard and falsified antibiotics. It also empowers community, vendors, and stakeholders to combat antimicrobial resistance. It seeks to access inadequate antibiotic stock and the circulation of substandard or falsified antibiotics that undermine effectiveness and accelerated the spread of MAR, ensuring access to safe, quality, assured antibiotics.
ComWatch, it's designed to be that easy-to-use solution that helps identify substandard and falsified antibiotics in Nigeria, and also help, patent medical vendors and community pharmacies, including Agrovet, to manage their antibiotics stocks as well. So we hope that this solution will be able to increase the kind of data that we need around antibiotics used in Nigeria and help the different regulatory agencies in Nigeria to take decisions around antibiotic use. This particular project is being launched today by the DG of NCDC, and we have the participation of NAFDAC because the entire solution is being built and aligned with the NAFDAC Green Book, which is actually the only recognized government regulatory agency to register all drugs that comes into Nigeria. So it means that what we are using the solution to do is that for every antibiotics we are helping to scan with the solution, that verification, is done at the back end with the NAFDAC Green Book. So which means we're having a close working relationship with NAFDAC.
Optimizing their use across 6 pilot states in Nigeria, Kano, Gombe, FCT, Akwa Ibom, Ebonyi, and Ekiti State. ComWatch aligns with strategic objectives of the National Action Plan, which focuses on strengthening procurement and distribution system to help eliminate substandard and falsified antimicrobials. Evidence links fitness to better concentration and result, improved cognition and teamwork. Regular PE and daily exercises cut obesity and builds fitness, strength, and immunity. Breed School hosted its maiden inter-house sports, in which it prioritized the mental and physical health of its children aside from its academics. Its aim was to ensure that it built leadership skills that ensured discipline as well as a better mental focus through inter-house sports.
Sports is part of health. It is important we key in, and from beginning we've been interacting with the school, and we supported in our own way by making a contribution, encouraging our children to come out in mass. They participated very well.
It exposes them to social interaction. In this kind of competition, they have the opportunity to mix up with other children in other classes apart from theirs, so they interact.
Studies in Enugu found that primary schools had better psychological well-being, lower stress, and higher self-esteem than less active peers.
It is important for schools to organize this kind of competition because it makes schools to nurture talents.
I hope they go home with unity. Sports promotes unity, togetherness. I hope they go home with unity and that togetherness among themselves. Yeah.
It is important that all stakeholders in the country, including parents, encourage their ward to engage more in physical activity for better health, well-being, and mental health. Welcome right back to Health Digest. Thank you so much for staying tuned. I hope you were informed by that. So today on the program, we're going to be looking at an interesting topic. On the 22nd of March is a day commemorated by the medicals, the health institutions, non-governmental, and pretty much everyone around the world. But we're going to be focusing the scope on a particular international organization. It is known as UNESCO. A lot of people know it majorly for its cultural aspect, but it's much bigger than that. It is the United Nations, education, science, as well as cultural organization, yes. So the 22nd of March is World Water Day, and on the show today, we're going to be looking at a different dimension with an international organization, as I said, that deals with quite a number of areas. It is called UNESCO. However, it is highly known for its cultural dimension, which is absolutely great. But it also deals with education, science, communication, in fact, and definitely the culture that you know. So we had the opportunity here on Health Digest AIT to speak with the head of office for UNESCO Nigeria. I'm talking about Dr. Paul Ngome, Dr. Jean-Paul Ngome. He is here with me today. Thank you so much for joining me.
Thank you very much, Ukeme.
Thank you. So is blue your favorite color, or is it because it's World Water Day, or is it because it's the UNESCO colors? Help me understand a little bit more.
Thank you very much, Ukeme. I like the blue, but I think that it was important to mark this very special day, the World Water Day, with blue color.
Quite interesting. Definitely suits you. So I'd like to know, what is World Water Day? I know that water is a basic force for life. It's, part of our very existence, but what is it to UNESCO?
Thank you very much. Water is life, water is health, and observing the World Water Day every 22nd of March is not just a symbol. It is a wake-up call for the world, a wake-up call for Africa and for Nigeria about a very important development issue, which is water poverty. Ukeme, 2.2 billion people in this planet suffer from water poverty. And when we are talking about Nigeria, which is the giant of Africa, it is more than 60 million people that suffer from water poverty. And it is important that this issue is, first of all, known and tackled appropriately.
That's quite correct. For you to be able to prefer solutions, you need to, first of all, understand the background of the problem. So what particular dimension is UNESCO looking at this year when it comes to World Water Day? Because it is something that UNESCO, does every year with different themes. So what is the theme this year, and what are we looking at on a broader scale?
When we are talking about water and water poverty, especially, we are talking about water access, we are talking about water quality. And as I've mentioned, among the many people that suffer from water poverty, girls and women are the most affected by it. And that's why this year the theme of this World Water Day is water and gender. Can you imagine that every hour a girl spends fetching water is an hour spent out of the school classroom, and it's important that it is known and it is addressed appropriately.
Thank you so much for that. Those figures, it's quite alarming, it's quite blowing that we never actually calculate to see what these little milliseconds and seconds actually amount to in the bigger scale. Now, that's one dimension to it. I know that UNESCO deals with education. It's one of its mandates. How exactly will UNESCO ensure that it utilizes education to reduce or alleviate or better manage, water poverty?
Thank you very much for this aspect of your question. First of all, I'd like to highlight the fact that there is no education, no health, no culture without water. It is important. And on that aspect, UNESCO is working very hard together with the Nigerian government to improve access to water to improve water management, to improve the rain water harvesting in this country. And for that, we are using the different programs we have, not only on water education, water research, groundwater management, such as the Ilubiden-Tasnaruf aquifer system that irrigates Nigeria and many countries in the western part of Africa. We are also tackling the different water risks that exist in this country, especially along the Niger River basin.
Wow, thank you so much for that. As a matter of fact, when the last note you ended with tackling some of the water issues, I remember the last time I came to your organization for a meeting. Sadly, I was a bit late, which you always tell me about it, but you had a meeting with the Japanese ambassador, and I know it had to do with water management. Could you give us a little bit more insights?
Yes, it's all about tackling one of the major water risks that exist, which is flood and drought, and especially flood. And we know that the rainy season is coming in a couple of weeks or months, and it's important that communities that are the most affected, as we have seen last year in the Mokwa community in Niger State, that we provide them with program that is helping the community to be more resilient to floods. And that's exactly what we have developed, thanks to the support of the government of Japan, to develop this project in the Mokwa community in Niger State to help the communities to be more resilient and to know how to react and how to prevent floods.
Interesting. Thank you so much for those details. Now, in the area of health and health information, because obviously lack of access to not just water but clean water has dire effects on your overall health system, your environment. So how exactly will UNESCO support the federal government to ensure that, you know, the water poverty alleviation is lifted?
Yes, with water, another risk is everything that is related to waterborne diseases, which is a plague in Africa, not only in Nigeria, and it's also important that through water education, we assist the communities, the families, on how to react to break the cycle of some of the waterborne diseases that are the most prominent here in Nigeria.
That's quite correct, because I've gone around 34 out of the 36 states in Nigeria, and I know that you can see me all dressed up, but I do get on the field, and in some of the communities, the waterborne diseases that I've seen, I mean, I went across the 6 geopolitical zones, and it's absolutely terrible lack of information what it can actually do. Now, let's look at another dimension, because we are looking at water poverty. So let's break down the poverty aspect of this. How exactly, you know, will there be some sort of support when it comes to entrepreneurship, the livelihood of these people in this area, to ensure that, you know, their standards of living are improved and sustained as well?
Yes, when we are talking about water, there is also a very important human dimension. I mean, it's impossible to develop an emerging economy without making sure that people are safe and have access to drinking water. Ukeme, do you realize that in this country, more than 70% of the water consumption is for agriculture? So if we have to help entrepreneurs that are working in this area of agro-processing and agriculture, it is important to invest also in water. To give you another example, do you know that $1 invested in water, it is $4 that comes back in terms of economic return? It is important not to disassociate water to economic development.
Thank you so much for those insights and those staggering, you know, indexes and pointers on the economic aspect of it. Thank you so much for that. I'd like to understand, how exactly will UNESCO be implementing some of these support when it comes to the alleviation of water poverty? You mentioned the MOU. the agreement with the Japanese government to tackle the flooding issues in Mocha community and so many other areas. So how are we going to be seeing other implementation processes, and which organizations will UNESCO be working with to implement this?
Thank you very much for this very important question. The first part of my answer is that first, UNESCO, being an intergovernmental organization, we primarily work with the government and with governmental entities, but we are also an organization of the field. We work with communities, as I've mentioned, in the Mokwa communities. We work with the experts, with the water experts. We have a regional center which is based in Kaduna, which is working on water issues here in Nigeria and also for the whole region. But above all, I would like to emphasize on the fact that our role is to ensure that people have the right knowledge to tackle and to face water poverty, to ensure that they are fully educated on how to use sustainably the water resources that are at their disposal, and also to make sure that they use it properly for their economic benefit as well, because a community that is water educated is a community which is more resilient.
Thank you so much for those insights. I hope this will not be the last of the conversations, because I hope to explore the E, the C, the everything. But thank you so much for that. It's been such a pleasure. Thank you, Dr. Jean-Paul Ngome, the head of Office UNESCO Nigeria.
Thank you very much.
Thank you so much again. Thank you so much for staying tuned. I hope you got educated and also informed of the opportunities available for the alleviation of water poverty in various communities, as well as to understand the different dimensions and the scope of work when it comes to UNESCO in commemoration of World Water Day, which is on the 22nd of March. That's the march we'll be taking on the show today. I hope you enjoyed that. Stay blessed and not stressed. I'm Ukemra Tukwa. Bye-bye.